Carrie Kowalski from Fanshawe College, and we're here to talk to you today about a very serious issue, needle stick injuries.
What is a needle stick injury? A needle stick injury is a break in the skin from a needle or another type of sharp. Sharps can include needles, lancets, auto-injectors, scalpels, and capillary tubes.
Needle stick statistics. It is estimated that in Canada, 195 needle stick injuries occur daily.
I just withdraw blood from a patient. What should I do now? Oh well, I guess I have to recap it.
No, no, no!
Withdraw blood from a patient. What should I do now? I guess I have to use the safety lock.
Yes, yes, yes!
The issues with the needle stick injury can be analyzed into each of the following perspectives: historical, ethical and legal, social and cultural, political, critical, and economical. Our group analyzed the issues that are only applicable to our topic. The historical analysis provides the opportunity to reopen nursing and healthcare history. It is an opportunity to look over the past history and find out the historical fact about the issues. The first time that the needle stick injuries arose in healthcare was after the discovery of HIV in early 1980s. The needle stick injury occurred when people recapping the needles after withdrawal of blood from the patient. Nowadays, this practice was improved due to the universal precaution and type of needles that people use. But the cleaners and porters who take care of medical waste are in high risk for needle stick injury due to the careless disposing of needles by healthcare providers. The interesting fact is that the risk of transmitting HIV by the needle stick injury is not that common anymore. Now, hepatitis B and C are considered to be more threatening and common to expose, and especially Hep C is a real issue because there is no vaccine to prevent it. We also analyzed the issue in ethical and legal perspectives. There is CNA's Code of Ethics, which discusses the nurse's obligation to care the patient with blood-borne diseases. According to the Code of Ethics, it is still the nurse's ethical obligation to provide the proper care to the patient, even though their patient is suspected to blood-borne diseases. And also CNA's Code of Ethics talks about the strategies that help the nurses to prevent from exposures to blood-borne pathogens. Nurses have the professional responsibility to regularly update their knowledge of blood-borne pathogen practices. Moreover, employers have a responsibility to keep their employees in safe and quality practice environment.
Some interesting needle stick injury facts is that many needle stick injuries are not reported. Needle stick injuries occur mostly in healthcare settings such as hospitals, nursing homes, community settings, and even at dental offices. Needle stick injuries cost the Canadian healthcare system between $45 and $73 million a year.
Oh my god, I got a needle stick injury. Wow. What I have to.
What happened?
Oh,
You
I
got
have a
an
needle
injury?
stick. Yeah, what I have to do?
Okay, you have to flush your hand first under the running water for 15 minutes,
Okay.
okay? Then you have to report your coordinator and you need to complete an AIMS report. Okay, after that you have to go to Occupational Health and Safety Department to report the incident, okay?
Okay.
They
Thank
will
you.
follow up it with you. They
Okay.
might draw your blood and the patient's blood and they will test it.
Okay, thank you very much.
I'm going to give you the heparin injection, okay? Do not massage the area, okay?
No. You cannot put the used sharpener in the garbage box.
Oh, I forgot it.
Okay. You have to put, always remember that, to put the used sharpeners in the sharp
sharps
containers.
Furthermore, to our video, let's recap what to do if you prick yourself with a needle. Let the wound bleed freely. Then rinse under cold water and wash the skin surface with soap and water. Do not scrub it. Report all incidents immediately. Contact your charge nurse and/or special unit in the hospital dedicated to taking care of needle stick injuries. If you're not in the hospital setting, please contact your family doctor or the public health. Get tested for bloodborne infections and check your immunized records immediately. Post-exposure evaluation. Provide confidential medical evaluation. Begin prophylactic therapy. Document route of exposure. Identify source individual. Obtain their lab records and test individual's blood. Review results with a healthcare provider. Barriers that contribute to needle stick injuries are recapping used needles, discarding needles into garbage cans or leaving them behind in bedding where people can get needle sticked, lack of safety devices on syringes, inconveniently placing needles into overfilled sharp containers, busy, congested environments with increased work pressures and rushing, frequent interruptions and distractions, or uncooperative and confused patients, transferring body fluids from containers to containers, and poor site selection and/or hand placement where you can be easily pricked. Prevention: protect yourself and others. Use universal precautions. Use oral medications opposed to injectable medications. Use needleless IV systems. Do not recap needles. Sharp containers in each room must be at reach and empty. Dispose of needles immediately in a sharps container. Again, do not overflow sharp containers. With confused patients, have another nurse assist you with holding patients or distracting the patient. Pre-medicate the patient. Example would be give Ativan under the tongue to help the patient calm down. Resolution and key points to needle stick injuries. Bloodborne pathogens can cause fatal disease. Take universal precautions, use PPE and safe work practices. Take your time. Do not recap a needle. If exposed, report and follow exposure incident procedures immediately.